Guys, welcome back to my channel. In this video today I will discuss about what are the important things that you need to discuss with your employer before joining a job in Saudi Arabia as a doctor. So the main important things I would be discussing here about the Eama issues, about the years of contract, and about the insurance policies and salary range, salary negotiation, about the accommodation and transport allowance, and also about the vacation annual holidays and tickets. These are 8 major points that I am going to discuss over here. So first of all, about the Eama. Usually if you are joining it as your first job, now your employer is the one who is going to pay for your Eama. It costs 2,000 Riyal for the transfer of sponsorship to your employer. The employer is the one who is going to pay for that, and other than that there is maintenance fees of Eama as well. The employer is the one who is going to pay for that as well, so make sure that they are the one who is going to pay for you. This is the Eama fee. And regarding the contract, it varies from center to center and hospital to hospital. Some of them are offering 1-year contract, some of them are offering 2-year contract, and some of them are offering 3-year contracts. Each hospital have their own criteria regarding the salaries and regarding the benefits they are going to provide you in addition to your salary. So you should ask them about that, and do ask them while signing a contract. Do ask them about the notice period as well. What would be the route of leaving? So notice period is very important, because sometime if you want to leave in the middle of the contract, they will ask you to pay the salary back. Like if you have a notice period of 2 months and you are telling them you want to leave suddenly, then you need to pay them 2 months salary in advance. So make sure whenever you are planning to leave your job, check with them about your notice period time. Is it 2 months, 3 months, 1 month, whatever it is, you need to complete that before your last date of work. So make sure that you complete it in order to avoid any loss of finance. So make sure before signing any contract about your notice period. And next thing is about the accommodation. You should ask them about what would be the accommodation. Are they going to provide you the hospital accommodation? Are they going to pay for your accommodation funds? Are they going to give you transport allowance or accommodation allowance? So must negotiate this thing before joining and signing any contract. Okay, and fourth thing is probation period. Usually every hospital and medical center, they have a probation period of 3 months, but this probation period is very important, because sometimes we are unable to adjust with a new job. If the work environment doesn't suit us, if you have any issue with them and you want to leave, then in this time period, this is the golden time that you can leave the job anytime. You are not entitled to any extra payment, like don't need to give the advance resignation and notice period. No need for that. So make sure with your hospital, wherever you are joining, make sure be sure about how much would be your probation period. If it is 3 months or 2 months or 1 or 6 months, it depends upon your contract and number of years of contract. Usually a longer contract, like 3 years contract, they will give you a probation period of 6 months, and if it's a small contract, they will give you a probation period of 3 months. So in this probation period, they can also terminate you anytime, and you can also leave anytime without paying any extra financial cost to them. And fourth thing is about the travel expenses. Like usually it is the policy in Saudi Arabia that if you are going to your home country, then they will pay the ticket for your the cost for your ticket for only one time in a year. The hospital or the medical center, wherever you are joining, they are entitled to pay the cost of your ticket once in a year wherever you are going. So make sure with them. And next thing is the annual leaves. Usually the annual leave is 1 month in 1 year, but it also varies from center to center. Some of them are offering 21 days working days, and some of them are giving 24 working days, and some of them are giving total 1 month of leaves, including the working days. So be sure about that before signing and joining the contract. And also some of them, sometimes you can distribute it according to your need as well. Like if you have an exam in between and you want to travel for 1 month, then you can ask them that I want to utilize this 1 month, you want to travel for 1 week, then you can ask them that you want to utilize this 1 week from your annual leaves. Most of the time they will deduct your annual leaves in this time as well. But if you want to get unpaid leave, then some hospitals are supportive for that as well. So these things should be acknowledged before joining the job. And next thing is about the dependents. If you have any dependents like your spouse or your kids, then you are the one who is going to be responsible to pay for their Eama as well as their medical insurance. Regarding your own medical insurance, the hospital is the one who will pay for your medical insurance. So also make sure that what would be your medical insurance. Is it class A, class B? What would be the benefits? You should be very clear about these things before joining the hospital. And about your family members, you are the one who is going to pay for their medical insurance as well as Eama. The fee I have already mentioned, it is usually 200 to 300 riyal per month. So just estimate for the yearly fee, and you need to pay for that. So be ready for that. Whatever role you are joining, you should have enough finances to pay for their Eama maintenance fee. And next one is malpractice insurance. Before joining any job, you should have the malpractice insurance. Once you will join the job, they are the one who are going to inform you that you need to purchase the malpractice insurance. There are many companies who are providing the malpractice insurance. You can purchase from anyone, but it's very safe to have malpractice insurance before joining any job, especially if you are directly involved with the procedure and high risk procedure. So always purchase this malpractice insurance before that. And last one is the salary range. It varies from from the level of experience, from the job you are joining, and from hospital to medical center, and also from city to city in Saudi Arabia. But I will just give a rough estimate regarding the GP, which is general practitioner. The level of job is same like medical officer in Pakistan, and in UK it is usually senior house officer. So in this level, the salary range is usually 6,000 riyal to 10,000 riyal to 12,000 riyal. If you're working in a normal clinic, like who is earning less income, then they can give you 6,000 riyal or 7,000 riyal. But if you are working in a big setup, big clinic, very well-known clinic with good earning, and also in hospitals, they may offer you 12 to 14,000 riyals. But this is the normal range, and also it varies from hospital, from your to your level of experience, and also the skills that you are having. If you have very good skills and your level of experience like 4 to 5 years, then of course your salary will start with 9 to 10,000 riyals. But again, it's a subjective thing. It varies from center to center and hospital to hospital. And regarding the registrar, if you have master's degree and not full fellowship, or you have MRCP, usually you are going to join the job as registrar with the masters, with the MCPS, and with the MRCP. You will be a registrar unless you have a structured training. So the salary range for a registrar is 16 to 20,000 riyals. Again, it's variable from the hospital to hospital. The next one is the senior registrar level. Senior registrar is the one having full training experience and full FCPS or any fellowship from any of the country, residency from any of the country. Their salary range is usually 22,000 riyal to 30,000 riyal. And finally, the salary of the consultant. If you have a Saudi classification of a consultant, then your salary range will be from 25,000 riyal to 40,000 riyal. Depends on specialty to specialty also. This is just the average amount I am giving. Even some of the hospitals, they are giving more than that, and some of them are even giving less than that. Depending upon your experience, depending upon the hospital you are applying, it varies. This is just a rough estimate. And if you are in surgical field, especially if you are consultant from the outside, like from the UK, Canada, then of course you will be paid more than that. Your salaries in good hospitals usually would be above 50,000 riyal. And last thing that you need to be sure of before signing the contract, about your working time and schedule. because the usual work hours allowed in Saudi Arabia are 48 hours per week. So if you are planning to join a medical center, they usually give 8-hour duty per day, so you need to work for 6 days in a week. Some of the hospitals and medical centers, they are there if you are, especially if you are specialist or consultant trying to apply for the outpatient setting, then your duty will be split. They can ask you for the direct shift of 8 hours, or they can ask you for a shift of split 4 hours. Like in the morning you will be working from 8 to 12, and then from 4 to 8. So you need to be sure, if you are especially a female and you have family issues, so be sure of them ahead of signing the contract, that what would be your working hours and what would be your schedule. Some of the centers may give you a straight shift of 8 hours, but they will ask you that either you need to cover morning or evening or night, so be sure of that as well. And regarding the hospitals can also give you an 8-hour shift of single straight duty, or some of the hospitals are also working on 12 hours basis. So this thing should be considered before as well. If the schedule suits you, then it's completely fine to go ahead with the contract signing. Usually the hospitals, they have 12-hour shift morning and evening. If they will ask you to cover 12-hour shift, as I mentioned earlier, total working hours would be 48 again. So in those cases you would have 3 offs in a week. So this is all about what to consider before signing a contract with your employer as a doctor in Saudi Arabia. If you have any queries, don't hesitate to ask in the comment section. If you like my video, please subscribe to my channel and share with your colleagues. Thank you so much. See you guys soon with another exciting video. If you have any special request that you want me to make the videos about that, any special topics, don't forget to mention in the comment section. Thank you again.